Welcome back. For years, people who suffered from chronic sinus problems didn't have a lot of treatment options.
That's right. But all that really has changed now. That's the good news. Dr. Madan Kandula is with Advanced Ear, Nose, and Throat Specialist, also known as Advent. Good morning to you.
Good morning.
Nice to have you on the show.
Nice to be here.
I think it seems like everybody I talk to has sinus problems, and this is the time of year where it seems like they start to come on as a result of allergies or colds or whatever. But how many people, to get to the numbers, suffer from what you would consider to be a chronic problem?
A chronic condition. About 1 in every 10 Americans.
Wow,
so real
that's
common.
high.
So everybody knows, you know, a few people who've had these sorts of issues. A lot of people who have these issues don't even really know that they are suffering anymore because they've been suffering so long. They just kind of
learn to live with it.
Forget what it's like to have a headache.
Yeah, the headache is just a common thing every day, and your nose is just stuffed up, and you can't sleep because you're stuffed up, and you know that's just, they kind of just assume that's life, and it's not.
Yeah. What were the ways that you could treat this? I mean, in the past, what people do, like over-the-counter medicine, just hope for the best.
Exactly. I mean, medicines and over-the-counter medicines are out there, and the prescription medicines are there. And for folks that have an active issue that we can get knocked out, that's great. Lots of folks just have chronic issues that they're sort of putting a Band-Aid on with over-the-counter nose sprays and things like that.
I know people who literally will take, a Curative or a Zyrtec every day.
Oh yeah.
And they're like, oh, that's just how it is.
Yeah.
But it doesn't have to be that way.
Well, it doesn't have to. I mean, if you've got allergy issues, then certainly sometimes doing medicines regularly makes sense, but if it's more going on than that, then that's not going to cut it.
And you hear so many stories. I mean, you deal with people who have this chronic problem every day. What do you hear from them in terms of how it affects their quality of life?
Kind of what I was saying before holds true. Is a lot of folks, once we get them up and running and once we get them on the other side of things, then in retrospect, looking back, they say, boy, I wish I would have done something sooner, or boy, I didn't really know how miserable I was until I wasn't miserable anymore. So, just the headache issue, the stuffiness, it's none of it's life or death. It's always just quality of life, but that's sort of, with our busy lives these days, that's the kind of thing that gets knocked, to the back burner a lot of times.
Yes.
But now, Advent, you have some answers, some solutions.
Yeah, I mean, I guess a part of what we are about is trying to figure out what's the best option out there for folks who have these issues. And we've talked in the past about various sort of specific treatment options, but really on all fronts, we've got on the diagnosis front, on the treatment front, we've got a lot of different options for people that are new.
Let's talk about diagnosis first, and that's why this picture is kind of key, right?
Right.
This is the MiniCAT?
This is the MiniCAT. So we've got the only one in southeastern Wisconsin, and what this is, this cute little girl there sitting there on the scanner. What it is, it sounds simple, but it's a three-dimensional X-ray of the sinuses, which gives us the information that we need to have. So if you've got chronic sinus trouble and you've been been pushed around and passed around, this is a way of seeing behind the scenes, like we can see here, back and see what the trouble is and see if we can correct that. So again, a lot of folks just assume that, boy, I just got to deal with this. But once we get some answers, that really is helpful.
Can you explain what is a balloon sinuplasty? You're the first person in Wisconsin to do one. Yeah,
and it's something I've been doing it for a few years now. It's really become widely adopted. It's actually, for certain instances, become the standard of care. And what it is we're able to expand the natural sinus openings without removing any tissue. And the beauty of that is that it's, as you would think, the back side of that tends to be pretty low key. So the back end of
there's not a lot of recovery from it.
Exactly. So which is nice, and we're able to preserve healthy tissue, preserve healthy anatomy, which is great. I mean, that's what I would want if it were me.
What kind of procedure is that? How does that work? Are you in the hospital
typically it's something that it's an outpatient procedure, so you go to sleep to have it done. Typically, there's times where we can do it when somebody's awake. A lot of times you do that in combinations with other things, but if it's just in isolation, it's very, very quick to do, quick to recover from, and it targets goes at the heart of the problem.
And does that MiniCAT kind of give you an indicator of whether somebody needs to go to that step?
Absolutely. So everybody who has anything like a balloon sinuplasty would have had a CAT scan. Now the other beauty of the MiniCAT is that it's a tenth the dose of radiation as a typical scanner. It takes 30 seconds to do. We just do it in the office.
Very safe.
It's very safe. It's safe as you can get, and it gives us that crucial information which allows us to treat people properly.
Another procedure that you pioneered is what's called coblation turbinate reduction, right? What is that exactly?
What that is, for people who walk around with a chronically stuffed up nose, whether it's from allergies or just their anatomy, what we can do, there's things in the nose called turbinates, which are little humidifiers, and those are the guys, when you have a cold and you just feel like you can't breathe through your nose, those are the guys that are creating the misery.
Okay.
Lots of people walk around like that.
Now we know who to blame.
Exactly. Blame the turbinate.
Right.
Now, what we can do to those guys is they're there for a reason. They're there to add moisture to the air when you breathe it in. What we're able to do is put a probe into them, which shrinks them down from the inside. What that does is it gets them out of the way. and you can breathe. And it's something we can do in the office. We can do it in surgery in combination with other things. Very easy to do, very easy to bounce back from. And then again, we haven't burned any bridges. We can always move up the ladder if we need to as far as other treatment options. But a lot of times that really unlocks the door.
This is great information because I do think he's exactly right. So many people just feel like this is just one more thing I have to deal with, but you could actually solve it.
Yeah, and you're giving a talk where you'll answer some questions of people's, but also